Hi, Valerie.
Hello.
How are you today?
I'm all right.
Good. So today I'm going to be talking to you about a scenario that I have. This is end of life, the stage of end of life, whatever. Um, and so this would be like hospice care, things like that.
Okay.
And so, like I said, I have been provided a scenario that I'm going to go over with you. I'm also going to go over some goals, and then a treatment activity to just help you be, as comfortable as you can and have the most independence as you can during this time. So, first, I'm going to go over your goals that we have set for you. So the first one, and these are not short term or long term, they're just kind of the same because we are only going to see you twice. So this is just kind of what we're aiming to get done during that time.
Okay.
So caregiver and client safely choose and utilize energy conservation techniques and adaptive equipment recommended by OT during ADLs and transfers. So I know that that's your big thing is the transfers and the ADLs and not having a lot of endurance.
Mm-hmm.
And that is certainly something to be worried about. Not in a bad way, but it's valid to be worried about, I guess I should be saying. So that's mainly what we're going to be focusing on.
What's ADL?
Activities of daily living. So that's your bathing, your dressing.
Okay.
So the next one is caregiver independent with use of adaptive devices as needed during ADLs and transfers. Again, that kind of relates to the first one. Determine modified techniques to participate in prior social and leisure activities with assistance as needed. Again, we're going to help you do that with energy conservation and adaptive equipment. 4, identify and initiate memory activities or possessions to leave for friends, relatives. So we can talk about that a little bit more if you want to. 5, consider all legal, financial, and burial. Hold on, I lost my place. Whoops. Burial considerations that are important to the client. And lastly, client, significant others, and caregiver will discuss needs and emotional response to declining abilities and impending death. So I know that that's like a really touchy topic, but it is kind of just something we have to do, and I do apologize for that. So what I want to talk about today is I just want to put it out there, some adaptive equipment that is available for this time in life.
Okay.
And it's really not specifically for this time, but it will help most during this time. So what I'm going to do is show you a couple of pieces. I'm trying to get the camera in it. Do you know what a rolling walker is?
I do.
Okay. Let me just ask you if you know what these are before. Do you know what a shower chair is?
Yes.
Okay. A reacher?
Is that where you used to grab stuff?
Mm-hmm.
Yes.
Then grab bars, but I will show you a picture of where to put grab bars, like in the shower. And I also have a handout for this as well to make things a little bit easier. So here's these ones. They're relatively cheap.
Yeah.
And then you see how they're like this.
Yeah.
You want to have them at all access points within the shower to help you kind of maneuver around the shower. What about a bedside commode? Have you ever had one of those before?
No.
Okay. And you know what that is?
Okay, I think so.
Okay.
Kind of.
So this is likely to be the one that insurance is going to cover because it's a 3-in-1. And they can save the little money they're going to.
Right.
So it's just like the ones I'm sure you've seen.
Yeah, I've seen those.
But this can also be used as a shower chair and as a bedside commode.
Okay.
So, yeah.
Gotcha.
And then you can also use it as a raised toilet seat.
Gotcha.
All right. And then, like I said, you have the rolling walker, reacher. So that's all the adaptive equipment that I have picked out for right now.
Mm-hmm.
Of course, that would really be determined as we start a treatment session and I see really what your deficits are, because reading is one thing, but then I have to see it, of course, to make sure that it's safe. And then also, going over this, and then also I will want to speak to your caregiver so we can practice, safety on transfers, so I can teach them how to use the adaptive equipment, just to make sure that everybody's safe. Because that's really our number one priority right now, is to be safe and comfortable. And so we certainly don't want to take any falls or anything like that. So I'm going to go down to these. So this is just kind of explaining what you have. I'm sure you've heard this a million times over. And then here's the progression of it. It's a little info chart. And then, of course, this is what I was talking about a second ago. All the adaptive equipment within a home, where to place it. It's a super good infographic. So I think that is all. I'm actually going to go over a couple of, I just remembered this, sorry. I'm going to go over a couple of resources and in and around your area. So this is Bradley Healthcare Everything Diabetic. It's a medical supply store. So you can pay for it or you can rent it for a lot cheaper, which is probably what I would recommend. I know you're having a little bit of an emotional downfall with all this going on. That's totally valid. I think that anybody would who is in your situation. So Elite Psychiatry of Tennessee is a psychiatry outpatient center in Dickson County, that they could probably help you with that, make you feel a little bit more comfortable with your emotions again. So we're just trying to remain that comfortability. And then I'm not sure, are you, do you know of any hospice places already, or, I mean, have you had to use any of them in the past?
I know there's one in Nashville there on, my dad was there. I don't remember the name of it. I think it was on Church Street, maybe.
Yeah. Well, here's one in Dickson. They kind of just, this is more, because you would want to stay at home, right?
Right.
Okay, so these are the people that hire the hospice nurses to come, and these are the people that kind of take control of your hospice care here in Dickson.
Okay.
Anyways, but that's all I have. Do you have any questions for me?
No. Am I going to get copies of what you've got there?
Yes.
Okay.
Yes, I will send you these copies, and then I have the handouts with me to give to you. So
okay.
We're good.
All right.
All right. Well, if you don't have any other questions, thank you so much.
All right. Thank you.